Okay, the next part of the trach checkoffs is performing trach care. We'll start with co-wipe, check physician orders, and for allergies, assemble appropriate equipment, wash hands, identify the patient and introduce myself to the patient, provide for privacy, and educate, explain, and evaluate. So today we're going to be doing trach care on this patient. I am going to go ahead and I've got all my stuff here. I like to bring these extra sterile gloves because the ones in this kit don't fit me. And I have my sterile solution here. I like to go ahead and get this open and then come in from the side, pour in my sterile solution, and then don't need that anymore. And then with my clean gloves, don't need to be sterile for this part necessarily. I'm going to remove his old dressing and, take the dressing off, assessing if like there were drainage on the dressing, the consistency, color, amount, odor, and then also assessing the site as well. And then just seeing like if I needed to replace his ties, are those dirty, and all of that. Assessing how much I really need to clean here for this particular patient. So getting rid of the old gauze. I'm done with these dirty gloves. So now I'm gonna go get into these sterile gloves. And before this too, we would make sure his oxygen situation was under control, pre-oxygenating him or whatever I needed to do to make sure that he's getting adequate oxygen while I'm providing care to him. So we're going to remove the inner cannula from his trach and place it in the sterile solution that I had here. Rinsing it off, making sure we're getting it good and rinsed, and then we're going to go in and clean it with this little brush that's in the kit, getting in there, making sure we're getting any of those nasty secretions out, cleaning the outside all around it, putting it back in the solution to rinse again, and then I'd be done with this little brush, so don't care about that. And then I'm going to take this extra dry gauze that comes in the kit and really dry it off before putting it back into his trach, because we don't want to, aspirate him on any excess liquids from the kit. Putting it back in after it's all clean. Okay, getting rid of that. And now we can go ahead, I don't like those gloves, clean the outside of the trach. And making sure I would put him back on oxygen after attaching my inner cannula. So using these cute little Q-tips, making sure that there's sterile solution on them, getting under, around the faceplate of the trach, just making sure whatever is visibly soiled, I'm cleaning it. And then I would just, repeat using as many Q-tips as I needed to make sure that that's all clean. Maybe if it was really, really dirty, we would need to use everything that's in the kit, but we'll just pretend that his trach is nice and clean. And at this point, sterility doesn't really matter. I'm going to replace the gauze that I took off earlier. And again, like I said earlier, if needed, if his ties needed to be replaced, I would, because they come here in this kit, but we'll just pretend like his is not that dirty. So after providing trach care, I would lower his bed back down, give him his call light, and then just go document my procedure and any abnormal findings.